When we came to class, we were given a vignette around breast self-examination. So the idea was a woman has had breast cancer in a group of friends, and she wants to find better ways to examine her own breasts that don't rely on poor judgment, that are not as anxiety-inducing, and that's what we initially started off with.
We take a deeper dive into this knee area and found that false positive was actually a big problem in breast cancer diagnosis. So every year there are 40 million mammograms performed in the US alone, and almost 10% of them reaching the final stage of biopsy turns out to be false positive. And that's associated with a high cost, both economically and also with the mental stress of the patient. So our initial need statement was around this false positive insight being a way to rule out breast cancer in women who has a abnormal screening mammogram in order to reduce the cost associated with false positive in breast cancer screening.
As we reached the midterm in our first quarter and as we were generating concepts, we were having a fairly hard time generating concepts and also creating very specific need criteria. And we slowly started to realize that was likely because our insight was incredibly broad. Our need statement was focused on false positives related to screening mammograms, but we were missing a second insight, which was the driver of these false positives, which meant that we were really shooting in the dark in a lot of ways. And I think the feelings associated with that kind of broad landscape were a lot of running in circles, and I think a feeling of ambiguity in our team that was really holding us back. Once we realized that we needed to make a pivot from our first need statement, our first task was really to look back at some of the research that we'd already conducted. So looking at our secondary research and research conducted by interviewing physicians and patients, and trying to reframe that to find that second insight of what is really driving screening mammograms. And we wanted to do that collectively as a team. So first we kind of took a divide and conquer approach. One of our team members synthesized all of our insights, and then two of us went ahead and created a brainstorming framework so we could visualize those insights around the needs and pain points of both patients and physicians across the screening pathway. And finally, we came together as a team and visualized all of those pain points again, both for patients and for physicians across the screening and diagnostic pathway. We did it together with sticky notes in the D school. And once we had those all visualized as a team, it was really easy for us to start clustering those insights and identifying a few key pain points and potential drivers of false positives that we could start thinking around need statements for.
At the end, we as a team decided on one particular need statement that we are interested in pursuing. That is a way to improve the comparison of the digital breast tomosynthesis, DBT, that's 3D mammogram, across time for clinicians trying to make a diagnosis, still in order to reduce false positive associated with breast cancer screening.
I think the first thing is to not rush it and just tweak your concept or modify anything without really going back through the process. We were tempted at some point to just be like, oh, we can make this little change and then everything will be good, but we're very happy that we didn't do that. But that we trusted the process, went back through all the information, looked back at all the interviews, the secondary research, and really made sure that the new thing we are pivoting towards is something that is grounded in all the information that we've gathered. That being said, I think there's an issue of never having perfect information. So we could have spent another week, 2 weeks, even months, just thinking about what do we think about this one or that one. And I think the advice is at some point you will need to make a call based on the information that you have available. And the third point is that is totally normal. You will never have perfect information. So I think we would all encourage every team to just trust the process, to not worry and appreciate that this is totally normal and that you'll come out in a great place like we did.